Hello, my name is Patrick Brown, Mayor of Brampton, and welcome to our weekly COVID-19 update. I'm joined today by Dr. Lawrence Lowe, our Medical Officer of Health in Peel Region. I'm also joined by Regional Councillor Paul Visante and City Councillor Harkirat Singh, who will have a brief update today as well. I want to start off by acknowledging that today is, of course, St. Patrick's Day. So happy St. Patrick's Day to everyone. I know it's not a traditional St. Patrick's Day when you can't gather in restaurants and pubs together to celebrate St. Patrick. But we are having a virtual celebration today in the city of Brampton from 2 to 6, and you can go online to join our celebration. We're going to have blessings, storytelling, and Irish performances. And I feel personally obligated to celebrate St. Patrick's Day because my father is Irish. My grandmother, who's still in good health and 106, even speaks Gaelic. So a happy St. Patrick's Day to all. This morning, I also want to recognize that it is 1 year ago today that Premier Ford declared the provincial state of emergency. And the past year has been marked with some of the most challenging times we've seen. However, it's also shown the strength and resilience and generosity of our community. And, you know, I continue to be grateful for the incredible people who have stood up, whether it's in healthcare, supporting the less vulnerable across the board. We've seen people really rise to the occasion and show their best. The first update I have today is in regards to transit. Today we have an update on transit, and that's in regards to the route that we canceled last week. That's now back in operation. That's the Steeles West Corridor. As you know, a week ago, we announced the closure of that route because it was our transit operators who expressed concern about feedback they were getting about Amazon, about a concern of a potential outbreak, and out of an abundance of caution, we canceled that route. We also had 3 cases of transit operators who had tested positive for COVID-19 on that route, 9 transit operators in the previous month, and although there wasn't a specific correlation between the outbreaks, it just shows you how interconnected our transit union is with the community. Because when the Amazon facility was shut down, it really was a verification of their concerns of this location. I want to thank ATU for being so interconnected, our transit operators being so interconnected to our community. And I would note that tomorrow is actually Transit Operator and Worker Appreciation Day. And so I think it's timely that as we look at the resumption of these transit services, that we also thank our transit operators who continue to be unsung pandemic heroes, who go to work every day knowing they face a greater risk because they are integral to our ability to function. And workplaces depend on transit to get their employees there, and our essential workplaces wouldn't be able to function if it wasn't for transit. So thank you to our transit operators. There's been talk about some amendments to the lockdown areas in Peel and in Toronto in regards to outdoor amenities and kids sports. I just want to echo my support for that. I saw the column today by Brian Lilly in Post Media, and if it's good enough for kids to run around at school with appropriate safety protocols, certainly they should be able to play sports at their local recreation center, and additionally outdoor amenities for everyone. You know, I am concerned. We have cardiac issues in Peel Region. We have rising rates of childhood obesity, and being active, being healthy, is interlinked, and I want kids to be able to participate in their sports, and frankly it's good for their mental health too. And so I'm hoping as these provisions, as these lockdown provisions evolve and get updated, I really hope that we're going to see some movement when it comes to the ability to stay active and participate in recreation. In terms of bylaw, we continue to see a high level of compliance by the community with the provincial regulations, and I want to thank them for that. Only 15 charges under the Reopening of Ontario Act. And to put that in context, when I talk about only 15, in the summer at one point we were looking at about 100 charges a week, and so this is drastically down, and it shows that the public does respect the guidelines from public health and the provincial emergency orders. In terms of an update from the William Osler Health System, as of today, there are 41 COVID-19 inpatients at Brampton Civic, including 4 in ICU. There is an additional 17 COVID-19 suspect patients awaiting test results at Brampton Civic. To date, our hospital partners have conducted 374,926 COVID tests. And of course, right now they are heavily focused on vaccines. As of today, Osler has administered 30,700 vaccine doses. This includes vaccinations to approximately 6,100 residents age 80 and older. Osler continues to ramp up its efforts of providing vaccines. Right now, they can do 1,250 vaccines per day at Brampton Civic and the Shinkuzi Wellness Center. But let me be very clear. If we had more supply, the amount of vaccines we can do in Peel Region would be tremendously more. You know, a few weeks ago we had this press conference and we said Peel Region would have the capacity to do 70,000 vaccines if everything was at full steam. And so, you know, I'm happy that we're getting vaccines out. I'm happy that we get that allotment in Brampton of 1,250 a day. But the only holdup is supply. And I hear groups all the time saying, you know, I want to be on this priority list. And I wish we could say yes to everyone. But the challenge is supply. It's supply, supply, supply. And until we get supply, there's going to continue to be people, residents, that deserve to be vaccinated, that have legitimate reasons of why that they're more vulnerable and need to be vaccinated. But unless we have supply, we're not going to be able to. And so I'm going to continue to echo those comments to the federal government that we really need to enhance procurement in a more timely manner to get supply so that our public health units and our hospitals can do the job that they are ready to do. You know, we have 3 mass vaccination centers in Brampton alone, 7 in the region of Peel that are ready. They're ready to really be in full steam, but it's all dependent on supply. So on that note, I'm going to introduce Councillor Paul Vicente for a quick update on an issue that's very important to Brampton, and he'll be joined with Councillor Harkirat Singh just to highlight our city's opposition to adding liquor services to 7-Elevens that is currently being considered. That's something that our council has unanimously opposed. And then we're going to hear from Dr. Lowe on an update from Peel Public Health.
Thank you, Mayor Brown. Good morning, everyone. I am Paul Vicente, the Regional Councillor for Wards 1 and 5, and I'm joined by my colleague from Wards 9 and 10, City Councillor Harkirat Singh. Today we are sharing an important update on the recent council decision regarding liquor sales at 7-Eleven stores in the City of Brampton. Brampton City Council strives to maintain a healthy and safe city for our community, and that is a priority of this council. Increasingly, more during the COVID-19 pandemic, we place a great emphasis on the well-being of our residents. On March 10th of this year, Brampton City Council passed a resolution to oppose 7-Eleven Canada Inc.'s liquor sales application at 2 locations in Brampton, 140 Father Tobin Road and 150 Main Street North. The city reviewed the application and considered all the relevant aspects, including the following: location and adjacent land uses, the potential for the presence of underage persons within environments of serving liquor, noise, loitering, and exterior lineups. With these potential impacts on public safety, Council passed a resolution to oppose the application. We look forward to the AGCO and to the province for considering Council's important input as part of their consultations. And we'd also like to point out the outpouring of feedback from the community here in the City of Brampton. We receive thousands of messages, hundreds and hundreds of emails from residents here in the city, clearly indicating their opposition to this application, and particularly during a pandemic like this one, to have that much feedback from the community. This council appreciates your engagement. We trust that Council's decision will have an impact in clearly reflecting the voice of Brampton residents in the AGCO's decision-making process. Thank you.
And next up, we're going to hear from Dr. Lawrence Lowe.
Thank you, Mr. Mayor, councillors, and good morning. Brampton's test positive this week is 8.7%, which is up from 6.5% last week. And the weekly incidence rate is at 145.6 cases per 100,000, which is up from 124.4 cases per 100,000 last week. This uptick concerns me, as our decline has stalled and our trends appear to remain unstable. We also know that our hospitals are continuing to see steady admissions, and that admitted patients are increasingly coming with the detected variant that are also seeing more severe illness earlier and also longer intensive care stays. I know that this week the province is reviewing the placement of Peel within the provincial response framework. And like many medical officer of health colleagues across the province, I make recommendations that consider the overall health of the community that I serve. In doing so, I continue to discuss with numerous stakeholders and our provincial partners how we can continue to balance the immediate health threat posed by the pandemic against broader impacts to health and well-being. New provincial data from the Ontario Science Table suggests that the growth of more transmissible variants is accelerating even here in Peel. Across Ontario, other communities have seen significant growth and the use of the emergency brake, and our Science Table colleagues are projecting that in 4 weeks, we could see thousands of daily new cases in the province, with associated increases in hospitalizations and deaths. In those 4 weeks as well, we are expecting many more vaccines that are projected to be deployed, though they remain limited now while supply is improving. These 4 weeks leave us little room for error. On its own, the uptick in our current viral picture does not support further reopening at this time. However, I equally know that everyone is tired. We all want this to be over, and I want to be clear, as I always have been, that your sacrifices have made the difference. They have saved lives and protected the vulnerable in our community and across Ontario. And I also know that many want to reopen, but they want to do so safely with the hopes of not closing again. We also know that the weather is improving and that these climatic changes would allow us to make the most of our outdoor spaces, where we know that strict adherence to precautions would further reduce a diminished risk of transmission in the outdoors. It's for that reason that I continue to explore with my provincial partners how we can strike a balance between the improving weather, the need to adjust measures on account for community fatigue, the vaccine supply, and the growth of variants. In considering our unique community context then, we are currently having active discussions that are exploring if we can maintain some of the protections afforded by the current measures that are in force here in Peel, but consider adjustments, particularly where there's an opportunity to leverage the outdoors for things such as dining and fitness. I want to stress that the discussions are still active and continuing. These are not final decisions, and ultimately, the province will make a decision as to where Peel lands in its review. That said, I share this information so that all can appreciate the very difficult balance we are trying to strike in maintaining caution and also understanding our current context. In the meantime, I ask for your continued patience as we push limited vaccine supplies out to the community. If you are a senior over 80+, urban Indigenous, or part of the very high priority healthcare worker category within the province's definition, please visit peelregion.ca/COVID-19 vaccine to determine your eligibility, and if you are, to book online. You can also call 905-791-5202 from 8 a.m. to 8 p.m. 7 days a week should you need assistance with booking. At the end of the day, patience is our weapon, and we should all continue to stick to the precautions. Stay at home as much as you can, and especially if you're not sick. And when meeting anyone else that you do not live with, practice masking, distancing, hand washing, and prefer the outdoors to indoors. And when your turn comes, please don't miss your shot. Thank you, and I'll pass it back to Mayor Brown.
Thank you, Dr. Lowe. And on that note, we're happy to take some questions. Graham Frisk from the Brampton Guardian is first.
Good morning, guys. How's it going? My first question would be for, I guess, Paul Morrison. if he's there. Ongoing protests that has been happening, I guess, every weekend now for a little while. Have any COVID violation tickets been handed out at any of these protests? I mean, what is the city doing to try to mitigate, I guess, the risk that these protests present?
Good question. Thank you, Graham. I can tell you that we are working pretty close with Peel Regional Police in addressing the protests. Peel Police has taken the lead. They have been having a presence at every one of the protests, whether it's being a very upfront presence or whether it be more in the background, depending on the size of the crowds and the volatility of the protest. They are continuing to monitor them, and they're going to do so until the very near future. And they are working with the protest leaders to try to change the style of protests. Hopefully, with COVID, people are aware we can't go out and do what we're doing. And I can tell you, they are looking at charges where charges are appropriate. We can't charge every unmasked person in the protest, and we can't charge every person who gathers in that social context because it's difficult. But we can charge the leaders of the organizations, the leaders of the protests, the organizers, etc., and we will continue to do so where it is appropriate.
Okay, thank you. Thank you. My follow-up would be for Mayor Brown. I guess last week at Council, a property tax deferment program was, I guess, extended. I'm just curious if you can give us some more details about that, and also why, I guess, some sex-related shops weren't included in that.
So that was in regards to our business licensing fees, and we had heard concerns from some primarily convenience store owners that during a pandemic, it's the last time that the city should be raising the fees on anything because they've been hit particularly hard. Brampton has some of the lowest business licensing fees in the GTA, and so there was an attempt to try to come up to have average business licensing fees that really helps recoup the cost of the services that the city provides. Having said that, we thought this was the wrong time, and so we canceled the increase that was planned, with one exception. You know, we have taken a strong position that there are certain businesses that we don't want in Brampton, and there are sectors that related to adult entertainment that we are proud to have the highest licensing fees in the country now in Brampton as a deterrence that that's not the employment and businesses that we're looking for in our city. Next question is Irene from 680 News.
Good morning. My question is for Dr. Lowe. We've heard from two groups that say a third wave has started, but not everyone agrees. I'm just wondering, Dr. Lowe, do you think Ontario, as well as Peel, now in a third wave?
Thanks for the question, Irene. Obviously, I can't speak for the rest of Ontario. Here in the region of Peel, in the last 2 weeks, we've seen a turbulent trend. We had 1 week where we declined, and then this past week we've seen an uptick. So I think if it is a third wave, it would be early days. Certainly, to the extent that I have shared what we are discussing with the province in trying to balance variants and vaccines and all these other considerations with our improving weather, it is really still in all of our hands to make sure that we forestall or mitigate as much as possible any sort of resurgence of the virus at this point in time. Thanks for the question.
My follow-up is, of the new cases in Peel, how many percentage-wise are variants of concern?
Absolutely. Thank you, Irene. At this point in time, we have approximately 40% of our cases that are variants of concern, and that is up from, as you know, percentages, lowered single-digit percentages. I think we were at 1 or 5% back in the middle of February. So in a month, we've certainly seen that growth, and that really speaks to one of the considerations that we're trying to balance in our current context, while trying to remain cautious, but also accounting for community health and well-being overall. Thanks for the question.
Okay, our next question is Denise from the Canadian Press.
Hi. Thank you for taking my question. I am wondering, last time I spoke to Amazon, or Amazon gave their statement, they said that they are going to dispute your order, Dr. Lowe, and that they don't agree with this. I'm wondering how that talk went, if you can talk more about that.
Okay, I'll have Dr. Lowe answer that, but let me just say that no corporation, no matter how large or influential, is more important than the health and safety of our residents, and I fully support the decision taken by Peel Public Health to have this 14-day closure.
Thank you, Denise, for the question, and thank you, Mayor Brown. In respect to your question, Denise, every Section 22 order that is issued, there is an opportunity for those who it is directed to appeal at the Health Services Appeal and Review Board within 15 days of the order being issued. And you'd have to ask the Health Services Appeal and Review Board if they've received any appeal. At this point in time, Peel Public Health is not aware of any appeal, and we do continue to work with Amazon through this closure to ensure that they are taking steps as directed in the order to keep their workplace, their employees, and our community safe. Thank you for the question.
And as a follow-up, I'm wondering if there are any new numbers in connection to the Amazon outbreak.
Yes, Denise. At this point in time, because our outbreak investigation is still ongoing, we are not releasing any further numbers. The numbers that were released were highlighted in the instance to basically highlight why the closure was done. But obviously, the numbers do change day to day as tests are completed and as contact tracing is also completed. So, rather than giving numbers out constantly, we really try to focus on making sure the investigation is done as best as it can. Thanks so much.
Okay, our next question is Steve from in Brampton.
Good morning. Questions are for Dr. Lowe. And the first question is, there has been discussion, as you mentioned, about maybe moving into a modified gray zone. Can you explain what that would look like?
Yes, Steve, like I said in my remarks, these are still points of active discussion with the province, but again, we're trying to balance vaccines, variants, the better weather, recognition that the community has been in closure for quite some time, and so there's a lot of different pieces that are being discussed with the province, but really a focus on adaptations around the outdoors as well as lower risk or other activities that could be addressed through precautions. So things like, as I mentioned, outdoor dining, outdoor fitness, outdoor exercises, these are not confirmed. I want to be very clear. We're certainly discussing it with our ministry partners, but it is about how do we leverage a changing climate, recognizing that when gray was originally written, that was as we were heading into the winter, and that and that now it's really considering for seasonal adjustments to the province to consider. So thanks for the question.
And the follow-up is concerning the Brazilian variant that has showed up in Peel region, which, from what we understand, has been very serious. Can you explain your concerns about that and how it got here?
So we actually don't identify a specific travel link to the P1 variant at this point in time that's been detected in our community. Overall, I think all of the variants of concern are certainly of concern to myself and to our public health unit, and recognizing, of course, in the region of Peel that we have all three, B117, B1351, and P1, that have all been detected in some form or another without a travel link. It really speaks to the need to continue to proceed cautiously, and the other aspect of those reopening discussions that I'm having with the ministry. Thanks so much.
Our next question is Sabrina from the Mississauga News. Sabrina, can you hear us? Okay.
Hear me?
Yes, now we can. Thank you, Sabrina.
Hi. Okay, great. So my two questions are for Dr. Lowe. So you said these next 4 weeks we have little room for error. Can you explain that more in terms of what do you need to see in these next 4 weeks to avoid more increased cases?
Well, so again, when we say little room for error, I was making that in reference to the fact that I do know that the province is reviewing our placement within the provincial reopening framework this week. We do know that many people are trying to find their way through what has been a very difficult and long period of closure with improving weather, with variants, and with vaccines. And so the issue being that we are seeing an uptick, whether people are able to maintain precautions, try to keep this under control. That is one piece. And within the same 4 weeks, we're also anticipating, based on allocations that have been described, that we are going to be seeing increased vaccine availability, which will hopefully help us to ramp up and start providing protection in a broader way across our community. So these are all happening at the same time together with the improving weather, which is really why it's such a fine balance that we're trying to strike at this point in time, and that's why I made the comment about there's very little room for error on this one, unfortunately.
Okay, thanks. And my follow-up question is, so I just want to clarify, when we're talking about a sort of modified reopening, are we talking about indoor dining or patio settings, and what about personal care services like a hair salon or a nail shop?
Well, I think all options are certainly being discussed. Certainly indoor dining is not something that I would support at this point in time. The focus has really been on the outdoors. How do we leverage the fact that we can make more use of our outdoor spaces in the coming weeks? And so I think recognition is diminished in outdoor settings, particularly if precautions are being followed. These are all active points of discussion with the Chief Medical Officer of Health in the Ministry at this time. Thanks so much.
Okay, our next question is Nitin Chopra from Prime Asia TV.
Good morning. Thank you very much. My question is for Dr. Low. Dr. Low, my question is in regard to the second dose of vaccine. We know that there is a shortage of vaccine, as Mayor is saying. And for the second dose, earlier it was recommended by the manufacturers that it should be within 21 days or 28 days. Supply of vaccine was already in Canada, and all of a sudden we hear that now all the vaccines can be given, second dose can be given after 40 days also. So how come when the vaccine was in Canada, all of a sudden this changed? This is the question of the community also, because they are very confused in this regard. How can label be changed? Because when we talk to earlier medical professionals, they said it's not okay if we delay than what manufacturer says. Thank you.
So Nitin, thanks so much. This is really about the idea of science and the evolution of scientific evidence with more and more data. When it was initially released, of course, you stick to the monograph. With greater evidence, there showed that there is significant protection with one shot, and so I have full confidence in the recommendations from our National Advisory Committee on Immunization, as well as our Ministry of Health colleagues who have basically directed that second doses be pushed out for 16 weeks. The aim is usually to try to you actually try to not make sure the two doses are too close together, but the second dose is actually where you're trying to, you're essentially getting immunity from the first dose and then a boosting from the second dose, and there seems to be a suggestion that the delay won't hamper people. On that topic, I wanted to be very clear to our community. There are many people whose second dose appointments are being rebooked in accordance with the ministry directive. Please don't take your frustrations out on our frontline staff. They are respecting the science, they are respecting the Ministry of Health's directive, and ultimately you will get the protection, the full protection as you deserve within the safety and efficacy of the guidelines as they've been provided. Thank you for the question.
Thank you. I have a follow-up for Mayor Brown.
Yes.
Mayor, yesterday we came up across incidents, and this is not of one of the kind. One of the international students, he came in front of a train and he died. He was residing in Brampton, but he was studying in the Montreal College. So two parts here, like one, this is not a new issue. What city or all of us can do so that we can save life, whatever reason it might be, crime or whatever, or these kind of suicides. Also, the issue is related of the housing. How come the other colleges, the cities like Montreal, the students are living in Brampton? Any action in the past city has taken, or in future, do you have any plan to tackle this situation so that no more lives should be lost in any way? Thank you.
Well, thank you for the question, and of course we want international students to live in a safe environment. This is the first time I've heard of someone living in Brampton going to school in Montreal. But Councillor Harkirat Singh has taken an active role working with the international student groups in our city. And so I'm going to ask Councillor Singh to speak to that in terms of the ongoing work with international student associations. Obviously, there was one incident in the summer where we worked with the Peel Police to make sure that no one is targeted and there's zero tolerance on violence. But I think overall we do live in a very welcoming community, and so incidents that we hear of are not the norm. They're unusual, but we do have to take them seriously, and Councillor Singh can speak to his work with international students.
Thank you, Mayor Brown, and always a pleasure, Nitinji. So, having been a professor in a previous life at Humber College and Lambton College, I worked quite closely with our international student population, and the issue of suicide is growing and really concerning to community leaders and organizations. So I can say personally, I know Social Mental Health, for example, World Sick Organization and other organizations have partnered with their post-secondary educational institutions to address this issue that you've raised particularly. Alongside that, we've seen organizations reach out to students directly. Student organizations become more mature and coordinate strategic partnerships. So we are working with our post-secondary educations and our nonprofit partners because it seems that this gap is very prevalent in our community and it needs to be addressed. I think with COVID-19, we've seen these gaps even increase and become more, as politicians, we've become more aware, and so you're going to see a lot of organizations turn to focus on this issue. Thank you.
Thank you, Councillor Singh. And we've got time for one more question. So our last question is for Nikki Cedrone from the Bramptonist.
Good morning. First of all, it's great to see that the vaccine rollout underway in Brampton, and we hope that the quantities will go up quickly so we can vaccinate everyone who wants it. But with the growing concern of variants now on everyone's radar, do you anticipate any challenges between getting people out and vaccinated so we can open up once again? Or is there increased likelihood that we will see further lockdowns despite the vaccine rollout, as we are seeing in Europe, for example, who have vaccinated much more people than Canada, and yet we still have regions going back into lockdown?
Well, let me say first of all that vaccine supply is a huge issue, and I wonder what position we'd be in today if Canada had vaccines earlier on, and that if we had the same type of supply we're seeing in the U.S. or the U.K. or Israel or the UAE. Obviously, I think there's a link between vaccine supply and lockdown restrictions. Having said that, I have said repeatedly that I don't think you can slice up the GTA, and right now I believe people are migrating to the open areas, whether it's Brampton to Vaughan, Mississauga to Oakville, Scarborough to Markham, and so I do hope that as the province rolls out new restrictions or new policies that there can be more consistency in the future. But in terms of additional restrictions, I'll have Dr. Lowe speak to that.
Yes, thank you, Mayor Brown, and thank you, Nikki. I think to the extent that this is a critical juncture, and that's why our discussions with the ministry are still very active as to how we proceed. We are certainly in a different position than Europe, which certainly has unfortunately seen their resurgence in third wave in the midst of just the last few weeks of winter. We are seeing a point where we might get vaccines just in time to forestall or mitigate a third wave. We have the opportunity to try to leverage the outdoors to help reduce transmission while also providing some respite. I think all of these confluence of factors are really where we're just trying to land the right balance that will allow us to continue to remain cautious and continue to keep this virus under control while we also try to get the vaccine rollout up and going. Thanks for the question.
Thank you, Dr. Lowe. Is there a follow-up, Nikki?
No, there isn't. Thank you.
Okay. Well, thank you for tuning in to our COVID-19 update. Stay safe. Happy St. Patrick's Day, and until next week.